tragedy took place when we lost 20 precious lives. The 20s are not, madam, just the statistical number. They are all human beings. They were my patients. They were my responsibility. They came on faith of Dr. Baruja and Jeff Golden Hospital.
Good evening. You're watching Left, Right and Centre. On the show tonight, the situation in Delhi remains grim. It's getting better in Mumbai, but the numbers in Bengaluru and Kolkata are now a matter of huge concern. In the last 24 hours, there have been 16,000 positive cases in India's IT capital, and in Kolkata, there are 3,868 corona cases amidst reports that the positivity rate may be shooting up and these numbers may be understated. On the show, like in the past, we speak to ordinary citizens in Kolkata and Bengaluru who speak about the impossibility of tests, of getting a hospital bed, and now, like in some other areas, many other areas, getting oxygen is beginning to look like a real challenge. Well, joining us now, Dr. Parmita Roy. She joins us from Kolkata. We're also joined by Suresh Srinivasan from Bengaluru. And let me give you a few details first about Parmita before I go across to her. Parmita has had a harrowing experience trying to get a cousin admitted. Could you tell us a little bit, Parmita, of what you went through?
Thank you, Vishnu. I'm telling you what happened yesterday evening. So I lost my uncle last Thursday, and this is his daughter, my cousin, who got fever from Saturday, and Sunday afternoon suddenly her SpO2 dropped to 72. We panicked and we left immediately to find a hospital bed. So the West Bengal government provides a very comprehensive list of hospitals on their website, and it shows up as a lot of beds, but what you don't realize sometimes that some of these are observation beds for healthy patients. They are not really for sick patients. We turned up at Bellevue. We had spoken to a few people. I'm a doctor. I'm a senior consultant at a cancer hospital. My husband's a doctor. My husband's brother is a doctor. So we know we have contacts in the city. We know people. So we had made a few phone calls before we turned up at Bellevue Hospital. But when we reached there, we realized that the bed which was promised to us was for most stable patients for monitoring. They have no oxygen there, and her SpO2, even after giving her oxygen, did not rise from 90 yet. They could not take her there. So we were waiting in the car. They were very proactive at the emergency with the doctor, the ward boy, just managing. They were very proactive. They came and checked her SpO2, gave her oxygen immediately.
All right, Parmita, I'm going to come back to you because the audio is dipping a little bit on you. I'm going to come back to you. Suresh Srinivasan joins us from Bengaluru. Suresh, your mother needed an ICU bed. The hospital didn't have one. How difficult was it to deal with this situation?
It was my aunt. She was 59 years old, and she had COVID. She was COVID positive this week, and we got an RT-PCR test. The first RT-PCR test was negative. We went to the hospital. We got a rapid antigen test. It was positive. They were ready to admit her for the time being, but since they didn't have the ICU with oxygen support, they asked her to look for other hospitals. We contacted government helplines. We contacted all government portals. We reached out to friends, colleagues. We managed to get one hospital, but by this time our oxygen levels had dropped much below 75. We looked up Twitter. We wanted to get all. We saw that even local MLAs were asking for help for their patients, and this was a very bad situation. This morning we lost her because from the ICU she needed a ventilator, and the hospital didn't have a ventilator, and she passed away this afternoon.
I'm very sorry to hear that. That's just awful. That's just unbelievably sad. Mr. Kumaran, a volunteer from Bengaluru, also joins us. He's been working day and night to get beds for people, and I think the sad part of this entire time in his life is that he's been unable to help as many people as he wants. So Kumaran, could you tell us a little bit about how difficult it is that when you see people who need help and you can't help everyone?
It's quite difficult. So what happens is when we kind of get requests from the volunteer groups, when I start getting calls in middle of the night at around 1 o'clock, 2 o'clock, 3 o'clock, and today I was woken up at 5 in the morning saying that a hospital in Bangalore does not have an oxygen supply. So can you please call up someone and then get that done? So I had to call up few officials here and there, and then we had to get it done. So with coming to respective with the beds and everything, what happens here is we do not have a single HDU bed and an ICU bed even now. Like I have 3 requests from my friends who have actually sent me messages, and I don't know, I don't have a option to show it to you guys. So they're saying that my aunt is very serious, Kumaran, can you just help with an ICU bed? So what do? We don't have an ICU bed. So when I'm talking to you right now, the government officials have agreed that the bed blocking system in Bengaluru is going under an update. The software has some bug. So from 10 o'clock today to 12 in the night, they're going to shut down the bed blocking system for 2 hours to update this bed blocking system. So what happens in this 2 hours? So within this 2 hours, a lot of patients' SpO2 goes down. So that's what is happening. See, what happened was day before yesterday, I had to ask some hospital for my friend's dad to be admitted. So we booked a bed. It's showing that the HDU bed is booked at the hospital. The patient goes alone. There's no one because the entire family is positive and they're all at home. Only they sent his dad in the ambulance and they sent him to the Apollo hospital. And when they go there and then these guys are saying that there's no bed. So we show them that yes, there is a booking that we have done. See this. So they say that no, it's actually some technical glitch. You have booked it twice. And then again, the patient had to wait there. So then I had to call up the BBMP commissioner, Mr. Gaurav Gupta. I had to call up the joint commissioner. I have to call up everyone in the war room of Bonalli zone. Then I told them this is what is happening and they are helpless. Then they asked us to wait for another half an hour to book another bed. So imagine when the patient is inside, his SpO2 is 88, you make them wait for half an hour, 45 minutes, 1 hour, 1.5 hours. His SpO2 is going to go down. There's no oxygen support in the ambulance. We did not even kind of expect the situation that it will go like this. So again, then they booked another bed. So the patient had to, so the ambulance had to drive over all the way like 5 kilometers to another hospital. So the patient got down, got admitted. By the time it was 2 o'clock, the patient's SpO2 was 82. When the patient first went to the first hospital, the patient's SpO2 was 90. And now when the patient was getting admitted, the patient's SpO2 is 82. Who's responsible? Who's responsible for all of this now? So that this is exactly is happening in Bangalore. So, and there is a single ICU and an HDU bed. ICU and HDU bed. I will come on record and I will tell you, I can challenge anyone in the government that in Bengaluru, we do not have a single HDU or an ICU bed. There are a lot of cases that is pending, a lot of volunteer groups like Mercy Mission, the emergency response team, everyone is working day and night to even book one bed for an ICU.
No, I take your point that the existing infrastructure is just collapsing. And it's so sad that a patient who should otherwise be in a hospital bed has their oxygen saturation plummet. And that's a situation one faces or hears about all over the country. Parmita, we've got your line back. Could you continue telling us what you went through?
Yeah, it's the same story here in Calcutta. No HDU, ICU bed, and there was actually no bed to take her, no observation bed also to take her in, to just administer oxygen and basic steroids and remdesivir. Even that was not available. She had to wait in the car till, some 5-10 of us from across the country, even from the UK, we were all trying to find a hospital bed. So the way to do it is to call up each individual hospital, trying to find a vacancy. The government portal is backdated by a day. So the number it shows does not reflect the true numbers. The government hospitals have a rule that you have to show a COVID report, get an admission, and that's impossible for somebody who's sick and has stomach SpO2. So it was a desperate help situation for me as a doctor as well. I did nothing to help her. Then finally, after 4 hours her in the car. By the time with oxygen, by the time we found her bed, she had to walk from the car to the ambulance, take her to another hospital where we found a bed in emergency. We didn't find the ICU bed, but she is thankfully stable tonight and getting treated.
What an ordeal. Ankur Goyal is a journalist from Kolkata. You were asked to pay 3,000 rupees or wait for 15 days for the results of an RT-PCR test. How difficult was it for you just to get a basic test done, Ankur?
Well, Vishnu, it was really difficult. In fact, I'll tell you for a fact that past 3 days since I started feeling the pain, or I felt like I had fever 3 days back, I thought the first thing you decide to do is go for a test, the basic RT-PCR test, so that people in your house stay safe. But when I started approaching nearly 40 calls to all the possible labs we tried to make, I wouldn't name the brands, but I got replies like some of them said that our testing labs have got contaminated, and these are some big hospitals I'm talking about. All the testing labs denied. After reaching out to some state level ministers also, I got some help with numbers, and through some not so popular test labs, when I reached them out, I got someone saying that okay, we'll test you. It's been 3 days, so I could not even go on medication. All the medication was based on either taking some vitamins or keeping up with your own immunity by eating decent food at home. But certainly to go to a doctor also, the first thought was, should I get the test done? Because you need to be safe for others going out of your house. And when I approached somebody, I got a confirmation. Later they say that we will be charging 3,000 rupees, or do one thing, you want the report after 15 days, then we are going to do it at the fair price, the price that is determined. I was like, how does it matter? Like, why would you charge me 3 times for something you're anyway making us available? And they said it's better than you get it done after 15 days. So there is no option. If you either self-medicate, but there is no other way that you can do it. But then I got some help from, I reached out at my level to some ministry, and of course I got help that we could also choose to go for tele-consulting with doctors. That might be one way to not always have the report in your hand or RT-PCR report, to go ahead and get some medication guidance instead of just going on vitamins and not knowing what exactly you're going through. But there are no tests available in the city at any cost. There were multiple numbers and approaches made in every possible network that I could have reached out.
Yeah. Reagents running out in so many parts of the country as well. Even in Delhi, there have been a lot of testing centers saying that they just can't test anymore. I'd like to thank you all very much for being with us and sharing your experiences in this horrific hour. It's a story which is being replicated very sadly in so many parts of India. In fact, it's the 5th straight day that over 3 lakh cases have been recorded in India. 3,52,991 fresh COVID cases, 2,812 deaths. India seeing a new record high as the deadly second wave sweeps across the country. Nearly 10 lakh cases have been reported in the last 72 hours. That comes to 242 new cases every minute. And I mean, if you just look at these numbers, on the 26th of April, 3,52,000 or 3,53,000. On the 25th of April, a day before that, 3,49,000. On the 24th of April, 3,46,000. So the numbers have been going up all the time. So what exactly has the government been saying in all of this? This was the message of VK Paul of the Niti Aayog, who's one of the key players as far as the government's efforts to try and fight this is concerned, about what people need to do even inside their own homes.
Please don't go out unnecessarily. Stay with your family. Very important. And also, even within the family, please wear mask. Please don't invite people into your home. This is not the time to do so. और घर में भी थोड़ा केयर रखिए कि किसी तरह से इन्फेक्शन कोई हो रखा तो हम बाकी भी बच पाएं, क्योंकि ये दिखाई देता है कि ये वायरस तेज गति से पकड़ते हैं ये. And we protect ourselves and we protect our family members to the best of our ability.
All right. Well, what the Home Ministry has now done, the Ministry of Home Affairs, is that they've issued a series of guidelines as far as states are concerned. Again, this basically indicates that the MHA, the Home Ministry, is not looking at a nationwide lockdown, at least not yet, but they are encouraging a series of steps where, on the basis of a graded response, state governments and district administrations can actually contain or have mini lockdown areas. Home Ministry has written to states saying there's an urgent need for states to bring the situation under control. States must implement an intensive, local and focused containment framework. State governments must ensure containment zones where there are clusters of cases, declared large containment zones if test positivity of 10% or more in 1 week, declare large containment zones if 60% or more of ICU and oxygen beds have been occupied. So those are the new steps. Joining us now to give us their sense of whether this would actually make a difference, Professor Ashok Seth, the chairman of the Fortis Escorts Heart Institute, and Rijo John, a health economist and adjunct professor in Kochi. Thank you both very much for being with us. Firstly, Dr. Seth, the oxygen situation in your own hospital, has that stabilized?
Yes, for the moment it's stabilized. When I say stabilized, instead of a 4-hour time frame, we now have oxygen up to a 12-hour time frame. So I think that's better than what it was, but we do expect it to stabilize further. But I think there's a whole load of centralized and coordinated activities which we can see now, and therefore I think it's going to get even better over the next few days.
Before I go across to Rijo John, I must ask you, Dr. Seth, now, you know, the new steps which Dr. V.K. Paul mentioned, the importance of, you know, protecting yourself, even if you're with family members, to wear a mask. Obviously, that's about if you're visited by family members, then people from outside, then you need to wear a mask. What does this say about the nature of the infection itself? How much more transmissible is it?
It is clearly virulent. I think this is basically because this is a variant virus, and we can see that happening. Say, just to give you an on-the-ground example, we know that it's twice more virulent, but when it's twice more virulent, it multiplies even further, and of course it's catching the young people now. So this issue about wearing a mask at home is not just related to people coming in, but you also must remember there are household staff who keep coming in also, and then there are asymptomatic individuals who transfer the virus with great virulence. So we now find families affected rather than earlier on last year where a couple of people in a family of 5 would be affected. We find that one person gets affected, everyone gets infected within a short period of time. So it is clear that it's more virulent, and that's the cause of this huge surge, tsunami as we call it, and the fact that our healthcare system is truly getting overburdened.
Mr. John, you know, the government has announced a series of steps without saying that there needs to be a nationwide lockdown. In Kerala, there have been lots of steps which have also been proactively announced. But what the MHA has said about 10% being a mark in terms of positivity in areas as, you know, an indicator at what level a containment zone or a mini lockdown has to be placed. What are your thoughts about that? Is that a reasonable marker?
Vishnu, if you've said 10% as the sort of threshold to set these guidelines, you know, yeah. I would say I was actually looking at the statewide TPRs across different states, and I see that 23 of the states or union territories now have an average daily TPR of more than 10%, and some up to 37% in Goa and Delhi. We have 32% TPR. So you know, it's almost as if a countrywide sort of an implementation of the same guideline in effect. We got 23 of those states having more than 10%. I'm not a medical doctor to really comment as to whether 10% is the right threshold. That I think the doctor would be able to clarify that. But what I can say is that data-wise, you know, to really implement a micro containment level lockdown, we need to be able to compute this test positivity rate. I mean, if you are going by this particular guideline, we should be able to examine this test positivity rate at this local level. But then at the moment, you know, even district-wise data when it comes to testing is not really available across every state. And of course, the state authorities might be having access to this data, but not in the public domain for people like me to really examine as to see, you know, which are the districts where the TPR is more than 10%. Maybe it's not even talking about districts. We're actually going deeper, a more granular level, you know, even at a panchayat or local board.
Right.
Rate and, you know, keep the lockdown to that kind of smaller pockets.
Mr. John, what is the situation in Kerala, which in the last over the last 1 year, at certain periods, we've seen an excellent response by the state administration in terms of tracing and things like that. That was last year. Then, of course, there was a huge surge of cases. At this particular juncture, where does Kerala stand in terms of what we are seeing in other parts of the country, rising positivity rates and hospital infrastructure being stretched?
Well, Kerala actually has gone through at least 2 peaks in the past, I would say. I mean, two sort of waves in the past. And now we are on to almost like a third wave, or I could say the second wave was never sort of came down due to the elections or whatnot. But now Kerala is one of those states which are actually adding to the active cases much faster than most of the states. I mean, if you look at the growth of average, the growth of active cases that is happening on a daily basis, Kerala would come to in the top 3 or 4 states right now. And its contribution as a share of the total active cases in the country now stands at around 8%. So it's clearly growing. The Maharashtra used to take the lion's share in active cases, but it has been falling for quite some days now. Kerala, fortunately, has increased the testing last few days, and that has clearly shown up in terms of the increased number of cases, especially in the last couple of days. And that I believe it's a good thing, even though we are seeing a rise in cases. Increased testing, a significant increase in testing is indeed a good thing. And I believe, one other good thing about Kerala is that in terms when it comes to vaccination rate, it's one of the best performing state in the country.
Right.
Among the bigger states, it's more than 16% of the population have at least 1%.
I just want to go across very briefly to Dr. Seth. As a heart specialist yourself, as a cardiologist yourself, is this a matter of concern about you meeting your patients who need your assistance? Whether it's actual surgeries or whether it's patients coming to meet you. They don't want to come to hospitals now, and there's good reason for that. So in as much as we focus on COVID, how is this having an impact on other patients?
So I would say after the lockdown, there has been a decrease in number of cases, understandably, and the scare that the people have seen over the last week. But I would say just prior to this, March was a very busy week for non-COVID. And that is because whole of last year till September, I would say, patients were wary of travel. At least travel wasn't even easily possible, interstate travel. They were concerned about coming to the hospital. But gradually from September onwards to perhaps March, everything was the people who had non-cardiac conditions wanted treatment. In fact, they'd been waiting for too long, and some had already advanced their treatment beyond a particular point when it was getting dangerous. So this is going to affect, firstly, those people. But then we also say at this time, those with non-urgent surgeries, those with non-urgent conditions should not cluster to the hospital so that we can concentrate on our COVID patients, because it's actually the same infrastructure, the same set of doctors and nurses who have to treat both. So at the moment, we're focusing on our COVID patients and also urgent surgeries of non-COVID type, cardiac surgeries, children's surgeries, and we're continuing to do that. The second aspect that I would want to emphasize is that we have been at the forefront of fighting this war against COVID right from the beginning. So it doesn't scare us. We mask ourselves well, we take all the precautions, and we also advise our patients and their relatives to take precautions. Unfortunately, there was earlier a scare in the initial part of the COVID battle, and patients and relatives were actually taking full precautions. But over the last few months, there's been clearly laxity in those precautions. We can now see, I must tell you this, Vishnu, as an example, that when we started our OPDs after the lockdown, patients and relatives would come wearing PPEs and sitting in front of us. Gradually, that has disappeared to 4 relatives coming in with their mask down on the face and even just around them, where we got to constantly remind them that we're not so worried about your father. We are taking full care, and so we are going to take full care of him. But we are more worried that either you'll pass it on to your parents or your relative, or you'll be passing it on to us, and that's not a good thing. So we're constantly reminding them. But clearly, COVID-appropriate behavior has to be the norm in the public. In fact, they should believe that if they get their mask down from their nose, then they're committing a crime. And finally, they're not just doing injustice to themselves. They have no right to do injustice and harm to somebody else. Unfortunately, it could be anybody who'll catch a COVID from them. Asymptomatic COVID exists enough in the population.
No, we just have to ensure that that COVID-appropriate behavior, Dr. Seth, works.
And
absolutely.
Also, unfortunately, they will probably one day transmit it within their own homes.
Yeah, and that's something that is a huge concern. I'm out of time, gentlemen. I'd like to thank you both very much for being with us.